Welcome, everybody, to another episode of the Health Heal Thrive podcast. I'm here with a very dear friend, Dr. Avi Charlton, who I know many of you will know because we tend to swim in the same circles. But for those of you who don't know her, there is always more to learn when it comes to Dr. Avi. She's always pushing the boundaries and trying new things and constantly inspiring me. So welcome, Avi. Thanks for being here.
Thank you so much, Tracy. We've been connected for a few years now, and it's been such an amazing journey. Thank you again for inviting me to another chat. I love it.
Yes, of course. I love hearing what you're doing. Well, I certainly love seeing, what you are doing. I think social media thankfully keeps people sort of connected when they're busy, doing their own things. And it seems like you're doing a lots of really exciting things at the moment. What's sort of coming up for you at the moment in terms of the biggest projects for you?
Well, the daily grind is just to see patients in the low carb clinic and trying to get more patients in and helping them with their journey, weight loss, lose weight, gain health, reverse diabetes, improve mental health. That's all the usual things that I do. And the next exciting thing that's happening is I've organized a dinner called the Low Carb Dinner in May. So 18th of May in the local restaurant in Mitcham. I'm inviting 60 people to come to have a dinner. We have three speakers, so two ladies, including myself. We've got Carla V. Carter, who's a nutritionist. She's going to give you some tips on how to do the low carb journey. And Charlene Lester is a health coach that specializes in neuro-linguistic programming and hypnosis. So we might have some exciting hypnosis going on.
That could be fun. That could be fun. That sounds exciting. So I'm interested, Avi, share with everyone, like what actually inspired you to actually branch and start your own, specifically low carb clinic?
Yeah, so it's been an awesome journey. I've been a GP for 20 years, but maybe around the last 4 or 5 years that I've started to learn about low carb through Low Carb Down Under, and I did courses with Nutrition Network and ACNUM. ACNUM stands for Australasian College of Nutrition and Environmental Medicine. So I did a few courses on weight loss, obesity, chronic conditions. And I've had great results within my usual general practice. And then I woke up one day 18 months ago now and decided that I want to start a low carb clinic. So I approached the boss and he said, yeah, all right, let's go. And he gave me a room and I started the low carb clinic, and I dedicate 1.5 days to book patients in a specialized clinic. We have a longer consult, up to 45 minutes. I gave the patients lots of time. Patients are committed and they're ready to change when they come in. And quite often they have amazing results. They have, they're motivated to learn and they know what they want and they have a goal set up. And I've had a lady who's lost 20 kilos over a year, and it's lots of amazing journeys, reverse diabetes. And because of setting up this clinic, I've branded myself as a low carb GP, and I've met other colleagues, health coaches, nutritionists, um, other specialists who have collaborated with me, and there's other businesses that's reached out, and we're doing lots of collaboration. I support the low carb businesses, and some of them are coming to the low carb dinner as the low carb dinner as sponsors with their products. And yeah, so it's been an amazing journey, learning, getting into contact with so many different people and industries. Very, very happy.
So it must be, I mean, incredibly different. You said it's been an amazing journey, but a really rewarding one. When you actually see patients actually getting results, has that been something that you've really seen as different between, your clinical general practice and then this low carb practice?
Yeah, absolutely. Yes. The patients that come into the low carb clinic really get results. I think it's a combination of many things because when they book in, they're ready to have change. They also pay the money, and that is quite often a big commitment. And they get a longer consultation. They get 45 minutes instead of the rush in and out 10, 15 minutes that the normal clinic provides. And I do give them ongoing support. I let them email me if they need to. Um, there is extra support program like my membership program called Low Carb Pro, which I Zoom the members every 2 weeks if they choose to participate in this program. And yeah, so I think these patients really get much better results than the usual patients that come in and out of the usual clinic.
Mm. So if someone's, you say that I mean, it is an investment, I guess, to sort of, pay to go down this path, but the rewards are obviously so much greater. If someone's listening to you and they maybe have been sort of sitting on the sidelines, really know that they've got to make some changes, their health isn't where they want to be, they've got no energy, they're overweight, all of these things that we know are a problem with poor metabolic health. What would be your advice in terms of where could they start in terms of really looking to make some real changes?
Yeah, there's a lot of things they can do. I think the first thing is just to be open-minded about what they can do and don't close in, and start learning and start discovering and start digging into the rabbit hole, and listen to a few podcasts and a few YouTube channels, and start learning and find out what they can do or what is out there. And I'm always open for them to make a 15-minute free discovery call or book in to see me, or even just a direct message on a social media. We can start talking and chatting.
Yeah, so it's it's important to realize that there's help there. It's just that you've got to kind of take that first step, really, don't you? Because it
Yes.
is your responsibility to do that. I think that's the hardest part, knowing that there is help there, but then taking that step, because so many people that we treat have just gone through this constant cycle of dieting and shame, and nothing's worked, and that's really because they're not really working with the right information, are they? And that's part of what you
Mm.
do is help them work off the right information in terms of diet. What are the biggest things that are different, I suppose, in terms of the diet, like in low carb as opposed to like the standard Australian dietary recommendations?
I think there's so many things we've got to unlearn, because in the standard dietary guidelines, we've been taught the fat is making you fat, the fat is clogging your arteries and erasing your cholesterol, and you're going to have a heart attack. So we've got to be open-minded to unlearn all these things and listen to alternative ideas. And I've done that myself. When I first started journey, I wasn't very open, and took me a few months of learning, or maybe a few years of, and I'm still learning about all the things that I've been taught, that maybe we need to revisit on what has been taught. Maybe fat doesn't make you fat. Maybe it's something else. Maybe cholesterol doesn't clog your arteries. And yeah, so there's so many things that we can learn.
Yeah, it is. But it's pretty uncomfortable, isn't it, to challenge that? But once we start doing it, it's like any practice, it's uncomfortable at first, but I think that's what we have to understand. If what we're doing and isn't working for us, we do have to have the courage to change that and to challenge our beliefs and to question it. And this is what I love now, with doctors like you, that you provide this just a really good safe alternative. So everything you do is backed by science. It's not woo woo. It's just that you maybe haven't come across this knowledge before. So, when you go to a doctor, you know that everything that you're going to say to them is backed by science. And, that's really going to help people feel more comfortable to step into, yeah, I used to believe fat was going to make me fat too, because that's what we were told. And it's very uncomfortable when you start adding fat back in, and you worry that it's making you sick or it's going to make you fat. But,
Yeah.
seeing, like looking at you and looking at me, and both of us eat and have been for a long time consuming lots of fat, and
Yeah,
I just
that's
keep
it.
getting healthier.
Yeah. There's actually, I just read on the weekend, there's over 1,000 studies on how low carb is safe and how the efficacy of low carb. So there's lots and lots of studies out there showing that we're not doing any harm and we're helping people lose weight, improving metabolic health, and all those things.
Yeah, absolutely. So you are a part of the Lived Experience Conference that I'm putting together in June. Thank you so much, first and foremost, for taking the time to come and share with the people that come to that event, your insider knowledge. So I was hoping you might be able to share with everybody, what you are bringing to the event.
Yeah, so we're up to on the event. I'm going to talk about breathing for medical conditions. About maybe a year ago, almost a year ago now, I dived into the rabbit hole of learning about breathing through reading the book Oxygen Advantage and doing the instructor course. I wanted to learn more and more about breathing. So it turns out that there's so many people that don't breathe properly, and we call it dysfunctional breathing. And in fact, everybody can have an improvement on breathing by measuring our our breath holding capacity, and improving our carbon dioxide tolerance. So there's so many myths that about breathing more is better. Actually, we don't need to breathe so much. It's like eating more makes you fat. Breathing more actually is quite detrimental to our health. So I'm going to talk about why we don't need to breathe so much, and breathing better is much more important than breathing more. So we should be learning about how to breathe in a better mechanical way, using our diaphragm deep into the chest, into our lungs. And we can learn how to breathe, tolerating carbon dioxide more, and changing the chemoreceptors in our brain, so we can we can actually improve our oxygenation. And there's so many conditions that can help, including asthma. We can breathe better, allergies, sinus problems, even anxiety, even reducing our fight sympathetic drive. So anyone can improve on the sympathetic drive. Sorry, we improve on parasympathetic, so we can improve and reduce our sympathetic drive, and we live better and less anxious, less running around, causing anxiety. So I think everyone can improve on their breathing by doing some breath work. The more you do, the more you'll benefit from it. And that's what I would talk about.
It's amazing how it's so similar in so many ways. You brought up diet, like it's so much about how, I suppose, the quality of what you're eating as opposed to how much you're eating. It's interesting. And breathing, I've never thought about it in that in context of, it's not about breathing more, it's about breathing better.
That's it.
Really interesting. So what are some of the things, that do get in the way of breathing? Because it's kind of automatic, right? We don't generally think about breathing unless we consciously think about it. So what generally does get in the way of us breathing, effectively?
That's the thing, not thinking about it. That's the thing
Not
that gets
thinking about
into So the more we are aware, the
Mm.
more we can think about it, the more we breathe through our nose and less we breathe through our mouth. So the more we remind ourselves we need to do nose breathing, then we can also remind ourselves to not breathe so fast. And slowing down can really help to improve the carbon dioxide toleration. And in that, it changes the curve, and we can absorb oxygen better. This is actually a scientific chemistry in our bloodstream, changing the carbon dioxide and oxygen balance.
Well, every our mitochondria, they need oxygen, right? So I suppose if we're not breathing properly, it makes sense that they're probably not getting everything that they need to give us the energy we need.
Yeah, that's right. So that's related to the hemoglobin. So the hemoglobin holds on to the oxygen more when there's less carbon dioxide. So we want more carbon dioxide. So we want to have a better capacity to hold on to carbon dioxide. Then the hemoglobin can release the oxygen molecules, and then we can use the oxygen molecules in our muscle and brain and all our tissues. So yeah, there's a bit of chemistry and science to it.
I'm sure you're going to make it pretty easy for people to understand that
That's it, yes.
in their daily lives. Just one question though, why is it better to breathe through your nose than your mouth?
Yeah, the nose is actually there's about 30 functions of the nose for breathing. The nose will filter out the germs, it will make your air warm, it'll increase the buildup of nitric oxide. Nitric oxide is another chemical which is really essential to open up our arteries and for brain health. There's many more functions of the nose. And if you don't breathe through your nose, the nose gets stuffy and you get more and more blocked nose. So if you don't use it, you lose it. The mouth, if you breathe through the mouth, there's no filtering, the cold air gets in, it irritates your airway. You've got more chances of sinus infections and asthma, allergies. And the mouth isn't used for breathing. The mouth is for eating. So we really should breathe through your nose all the time, including our daily living, when we're working, when we're answering emails. Sometimes we don't remember. Even when we're exercising, even when we're sleeping. So people don't know if they're breathing through their nose when they're sleeping. So that's why we talk about mouth taping, and people freak out and they think they're suffocating. But we can talk about ways on how we can mouth tape safely.
Mouth tape, I love it. I know we both do it. We've talked about this before, but it's like probably 2 years. I think I've been doing it now. It's like a little it's like a security blanket. It sends the beautiful signal to it's time to sleep, and I find it really comfortable. But I didn't do it for ages because of those fears that you mentioned. My husband started probably 2 years before me, and I just thought, oh no, I'll feel like I won't be able to breathe. But there's definitely ways around it. Exercise too. I'm so aware. Like if I still go out for a run, I haven't trained myself yet to breathe through my nose. I still mouth breathe. So I'd be so interested on that at that event to ask you about how to build up sort of a tolerance to be able to do it for training. It is so important, isn't it?
Yes. Most of the time when I run, I breathe through my nose, and I've trained up to it. When I'm doing a very hard session, sometimes it's the first kilometer, it's nose, and then it changes to a mouth breathing if I'm exerting very hard. I think that's okay, but most of the training breathing through the nose, I think that will really build up exercise tolerance, and it's so much better than breathing through the mouth.
It must increase your lung capacity too, because you really have to work harder, don't you, to get it in. If you're used to to me, it's like the easy way out, as opposed to really training to go through the nose. Again, so many similarities with all the choices that we make. It's easy to sort of go for the cheap, crappy food. It's harder to prepare, the real food and to cook it. But the rewards of doing the hard stuff are generally far greater.
Yeah, absolutely. That's it.
Awesome. Well, I really can't wait to see you. I know we both live in Melbourne, but we don't tend to see each other that often because we're both, obviously busy with life.
Yes.
So it'll be lovely to see you at the Lived Experience Conference. And there are currently, as we record, a few tickets still available. So if you are in Melbourne, or you can get to Melbourne, there's plenty of people traveling to come to Melbourne, which is awesome. But do consider coming along and meeting Avi. She's very friendly. She's very open to chatting. And she'll be around, not just for her talk. She'll be there that you can talk to her in the smaller rooms if you're wanting to. But yeah, do come along. Thanks so much, Avi, for talking to us today.
Yeah, I can't wait to be in your event. There's so many speakers. I love all the events, even online and face to face. I love all the events that you organize. And there's so many different topics all the other speakers are talking about. And thank you, Tracy, for sponsoring my dinner as well next month. So next month on the 18th, she's gonna have one ticket to give away in a lucky draw. And so if you come to my dinner, you can have a chance to win that ticket to her event.
Yay!
Yay!
I have that one set aside just for your lucky winner. So
Great.
thanks again, Avi. Thanks very much. I'll talk to you again soon.